No. Hi, I'm Brianna.
And I'm Shayna, and we're going to be presenting intake and output
And meal percentage, and Bridget is going to be showing a PowerPoint after the video on fluid restrictions and patient feeding. Bye! Nutrients are elements necessary for the normal function of numerous body processes. With the help of My Plate, we are given a meal percentage for all ages. U.S. Department of Agriculture and U.S. Department of Health and Human Services created an average daily consumption guideline for 5 foods: grains, vegetables, fruits, dairy, and protein. Patients have different food preferences when it comes to their race or ethnicity. My Plate is a guideline for balancing calories, decreasing portion size, promoting healthy food, increasing water consumption, decreasing fat, sodium, and sugars. However, we may have to adjust certain percentages to meet the needs of a special case, such as increasing protein for a patient with a wound. Children 2 to 8 years old need 1 or 1.5 cups of fruit. Girls 9 through 18 years need 1.5 cups. Boys 9 through 18 years need 2 cups. Women need 2 cups, while men also need 2 cups. Fruit can be any of the following as far as cup of fruit, 100% fruit juice, or dried fruit. For vegetables, children 2 to 8 need 1 to 1.5 cups. Girls 9 to 18 need 2.5 cups. Boys 9 to 18 years need 3 cups, while women need 2.5 cups. Men need 3 cups of vegetables. Grains consist of whole grains and refined grains. Whole grains is whole wheat flour, brown rice, or oatmeal. Refined is white rice or white bread. Whole grain, however, is healthier due to the fact that it consists of the entire grain kernel. Children 2 to 8 years require 5 ounces equivalent. Girls 9 to 18 years require 6 ounces equivalent, while boys 9 through 18 need 8 ounces. Women require 6 ounces, while men can require 8 ounces. 1 slice of bread, half a cup of rice, or cooked pasta is 1 ounce equivalent for grains. Protein consists of meat, poultry, seafood, beans and peas, eggs, nuts, or seeds. Children 2 to 8 years require 4 ounces equivalent. Girls 9 through 18 years require 5 ounces. Boys 9 through 18 require 6.5 ounces. Women require 5.5 ounces, while men require 6.5 ounces. 1 ounce of meat, poultry, or fish, 1/4 cup of beans, 1 egg, or 1 tablespoon of peanut butter is equivalent to 1 ounce for protein. The dairy group consists of milk, yogurt, cheese, cream cheese, or soy milk. Children 2 to 8 need 2 cups of dairy, while girls 9 through 18 years need 3 cups, boys 9 through 18 need 3 cups, women need 3 cups, and men also need 3 cups. It's not all about the portion for the patients, but a balanced diet to meet their needs. My Plate is simple for a patient to understand and help nurses record the percentage before and after their consumption. The first image shows that nothing on the plate has been touched, therefore it is 0% consumed. The second plate shows that 25% of the plate has been consumed. This could also be graded as poor. The third plate shows that 50% of the food has been consumed. This could also be graded fair. The fourth plate shows that 75% of the food has been consumed and would be graded as good. The fifth plate shows that the whole entree has been consumed and it would be graded as excellent. Some patients will not be able to eat 100% of their meals due to altered nutrition. However, for care plans, goals should be realistic as possible instead of stating you want the patient to eat all their food. If the patient eats less than 25% continuously, there may be other issues and new goals and interventions may need to be set.
What is it? A banana! What nurses will need to record? You will need to record all intake of fluids. This will include oral and IV fluids. You will also need to record all output of fluids. This will also include urine, emesis, and stool. For the average infant, they will need to have at least 4 to 8 wet diapers a day. This is to make sure they are getting adequate fluid intake. Also, this is extremely important for breastfeeding mothers. If the child is not getting enough breast milk, one of the first signs is usually not having enough wet diapers a day. For the average older child, they should be eliminating urine at least 4 to 8 times per day. The average adult should be eliminating around 400 mLs to 2,000 mLs a day. Men should be consuming around 13 cups of fluid per day, which equals to 3,120 mLs. Women should be consuming around 9 cups of fluid per day, which is equal to 2,160 mLs. Infants need to be consuming about 6 bottles of formula a day. However, this does change with passing months. They start out with needing more bottles, but decreases as they get older due to the fact that they start to consume solids. Children need about 6 cups of fluids per day, but also like anything else, it depends on the age group as to how much they should be consuming. When holding in urine for too long of a period, it can cause a urinary tract infection, which if not taken care of, can migrate to the kidneys. You can also experience incontinence. For all ages, the normal bowel movements per day are anywhere between 1 and 3. However, someone's lifestyle, age, and food consumption play a factor in how many bowel movements they will have per day.
Yeah, you're good whenever.
All right, sir, I'm going to be checking your Foley cath today to see how much output you put. You're just going to pull this out. You're going to open it, and if you're not sure, you can always tilt it, and if it doesn't meet the line and you're unsure, all you're going to want to do is take and lift and dump it into the cup. And then when you're done, you always want to take an alcohol swab, clean it off, close it back up, and you're always going to want to stick it back in so it's secure. This is how much water a normal glass of water would be for 8 ounces. It is also equal to 240 mLs, and you are going to want to make sure that you don't record the 8 ounces. You're going to want to record 240 mLs. You're always going to want to make sure that there's a hat in order to be able to tell how much urine somebody is going to the bathroom, especially when you're trying to make sure of how much output they are doing. This is 800 ml, and you're always going to want to record it in the ml. You never want to do it in the ounces, otherwise you will have to convert it.
'Cause baby, now we got bad blood. You know it used to be mad love. So take a look what you've done.